Matthew Lee, Inner City Press, on behalf of the Free UN Coalition for Access. Thanks a lot for the briefing.
You're
I actually want to follow up, just ask for, I guess, some more specifics. On Yarmouk, I mean, obviously you've seen the reports that Daesh is sort of taking control or gaining ground, and I just wonder, when you say that they're a renewed focus, what would you propose? They say, I've seen one account that says that they have 3,000 to 4,000 fighters in Yarmouk, whereas Nusra has maybe 500. I mean, although you're saying you're not there, but if you speak to people coming out, what would be your proposal to make the lives of those still in the camp easier? And also, just on the budget, I've seen that there are some questions raised about UNRWA's health offerings to refugees that are in Lebanon. And is this related to a budget cut, or is it something that people don't understand, sort of a change? And even on the food thing, if you're giving cash, will this be indexed to actual food prices? Like if food prices go up, will the amount of cash given to people also go up? Thanks a lot.
Thank you very much. So on the Yarmouk control, we read and we've heard the same reports that you refer to in terms of the progress and the role of Daesh inside the camp. I think for us the focus is going to be on the impact of whatever change takes place on the situation of civilians. That's our focus. And here we did see, in the context of the discussions that are taking place in Geneva, that of course space did open and improve somewhat in terms of access to some of the neighborhoods. So, for instance, the facilitation, including by the Syrian government, of our access to the areas like Yalda, Babila, and Betzahem in recent months, that has been clearly since felt by us as an improvement. Now, we know this needs to be extended and expanded. I don't expect that the access into Yarmouk will see any immediate progress. But if the situation that we've had in previous months, whereby people can safely leave the Yarmouk camp, collect their materials, and go back to their families, if their choice is to currently be inside the camp, that's for them to make. I think it is, therefore, from a humanitarian perspective, the question of access that is the imperative. Access and security, because, as I said, we did lose many people also, but this is what I would continue to urge member states and other countries to continue to push for, is while the political process continues with its ups and downs and challenges, that one advocates for improved access to it in a variety of forms. The budget issue on Lebanon, without going into too much detail, in the sense of not wanting to bore you with that, but it's a change in our hospitalization policy. In 2 words, UNRWA provides free healthcare provision in our primary healthcare centers. We have 130 of those throughout the region, of which roughly 20 are in Lebanon. So if a Palestine refugee goes to one of these clinics, they will receive free of charge primary healthcare. If they need to be referred to a hospital or a clinic for secondary or tertiary care, then UNRWA, throughout our fields, will pay a certain percentage, will reimburse a certain percentage of those costs. Because of the levels of poverty among Palestine refugees in Lebanon, we used to, until the end of last year, reimburse a full 100% of those costs. Now, that's a challenge for any agency. By the way, no government would do that, and it is very challenging to sustain that in a context of increased costs of hospitalization and the bills that come forward. So we introduced a cost-sharing element, which fully understandably raised the concern among refugees about what that would mean in view of their levels of poverty. To participate in some of the secondary or tertiary, well, tertiary they always had to participate, but in secondary care, that created the unease and sort of the restlessness and some of the challenges we faced. So what we did was to open a space for dialogue and trying to find ways to improve the policy, to take into account some of the concerns that were expressed, and we established a fund that will help those who are the most poor in the community to address some of the needs and to ensure that they don't, that they're not prevented from having access to proper treatment as a result of this change. But I'm sure it will still take a period of dialogue to overcome some of the issues that came up. That's how we're approaching it. The cash index is an important point. That's a question that comes up very frequently and quite legitimately from people. Say, okay, you've now saying this amount, what if the prices change? That's certainly something that we will review on an annual basis to look into. Now, One also has to say that for the regions concerned, it is in economic terms certainly more interesting that the cash is therefore invested directly in the local economy rather than importing food from abroad. Right? So this is also a case we made that there's a double benefit in principle for the people in terms of flexibility, but also for the local economy, since the purchases are made locally from now on and no longer simply importing food from abroad.
Thank you very much, Mr. Krähenbühl. Have a good afternoon, everyone. I'm sorry he's got to go to an interview at this stage. Thanks very much.
Thank you.